Good evening from New York. I'm Lawrence O'Donnell in for Keith Olbermann. Once, Senate Democrats said they would pass health care by the fall, but let it sit in committee. Then Thanksgiving, but let it simmer with the leadership. And now, Christmas Day. In our number 5 story, one minor hitch among many, Senate Democrats have not yet finished writing the bill. But the current Harry Reid hope is for a final vote on the bill that does not yet exist and has not been scored by CBO at 7 p.m. on Christmas Eve, after the all-important make-or-break hurdle coming with a vote on Monday. That schedule was made possible, hypothetically possible, after Democrats got help from across the aisle defeating Republican leaders who wanted to slow health care down by voting against hundreds of billions of dollars in equipment, training, mine-resistant vehicles, and pay raises for America's troops, whose funding runs out at midnight tonight.
Senate Republicans so desperately want to turn their backs on Americans who are suffering and dying for want of decent health care. $45,000 a year, 750,000 bankruptcies, 140,000 losing their insurance every day. That they're turning their backs on America's troops at wartime.
Of course, Democrats always knew that Republicans would drag their feet and use parliamentary delay tactics. Even with Republicans out of their way for now, it is only Democrats who remain blocking the way forward. It is the effort to appease Nebraska Senator Ben Nelson on abortion. He opposes insurance coverage of it, that has Democrats still writing the bill. And now Senator Nelson, who has cast himself as an almost there vote, has a more general problem with the bill. Senator Nelson was asked on local radio yesterday whether he would vote not for the bill, but just for Democrats to get an up or down vote on it if he got everything he wanted on abortion. His answer was no, because the bill does not have real cost control.
The way in which money is raised is not acceptable, and so if there isn't a way to raise the money in tight times, I think you have to look at a scaled back version. I've said this needs to be handled on an incremental basis. We need to address first. It's not that it's not important to find coverage for people. I think that's essential. But the first order is to get costs under control. Because let me be clear: if we don't get costs under control under the current system, adding more people just makes the problem bigger.
Of course, Senator Nelson was a key player in eliminating cost control from the bill by opposing the public option. In a rare scolding of the Senate, Obama senior advisor David Axelrod yesterday said, quote, "The main thing I would say to Nelson and other members of the Senate is that after a long, thorough debate, let us have a vote." Progressive independent Senator Bernie Sanders also remains a question mark, however. And in an interview with Salon today, former DNC Chairman Howard Dean renewed his call to vote against the bill, saying, quote, "We didn't elect Democrats to pass crap." Let's bring in MSNBC political analyst Eugene Robinson, also an associate editor and Pulitzer Prize-winning columnist at the Washington Post. Good evening, Gene.
Evening, Lawrence.
Gene, how did it come to this for the Democrats? Is their current position not precisely where their own tactics, have led them?
Absolutely. Which Democrat should I start with? It was the president's basic outline for how to proceed was to let Congress do it, and so this is what you got out of the Senate, and you've got 60 Democratic votes, maybe, period, not one more, not a margin of anything, a margin of zero. And so that means that any one senator can make what are either principled or extortionate demands and hold the thing up. So that's where we are, but it is the tactics that were chosen that brought us here.
And these senators can move their own goalposts goalposts, as we've seen Joe Lieberman do. A few months ago, an optional buy-in to Medicare for people under 65 was okay. Then when they actually came up with that idea, it wasn't okay. With Ben Nelson, he seemed to isolate recently just on the abortion issue. That seemed to be what the Senate needed to do to make the bill work for him, was find a way to keep abortion out of these health care plans. But now he seems to be saying something much more general, much more troubling, it seems to me. If you're Harry Reid trying to get his vote, he's worried about cost control. He's worried about the fundamental design of the bill now, isn't he?
Yeah, absolutely. I mean, he is saying, if what I've read about that interview is correct, and then we listened to the soundbite just now, is that, you know, this bill covers too many people. We can't cover all these people. We have to cover a lot fewer people with this first incremental step. That seems to be what he's saying. That's completely counter to the essence of the bill, to what this bill is trying to accomplish. And so, if that is really his position, then why are we going through with this exercise? Because they don't have his vote for this bill. Now, he had a private meeting with Harry Reid this evening, I understand, or late this afternoon. He came out Nelson came out making what sounded like semi-positive noises. So we'll see how that shakes out as the evening wears on and as we go into tomorrow. And
Ben Nelson has a long and good history with Barack Obama. He's one of the senators who helped Barack Obama get to the White House, one of the early endorsers of Barack Obama in the Democratic field for the presidency. They've asked Bob Kerrey, former Democratic senator from Nebraska, to help with Ben Nelson. Does the White House have any way to get to Nelson that Harry Reid doesn't have?
I am not sure. White House aides, including the deputy chief of staff, were up on Capitol Hill today trying to understand Senator Nelson's demands and assess them and figure, I guess, how to respond. I would imagine that in this sort of situation, you always have in your back pocket the phone call, the visit, whatever from the president himself, if it comes to that. But I think you want to try to deal with it before it comes to that. But at this point, I think the White House, you do what you got to do.
And finally, Gene, the Senate schedule. Harry Reid has a week or a few days scheduled in front of us like I've never seen before. I just got on my BlackBerry the schedule for tomorrow morning. Senate convenes at 6:45 a.m. There will be votes at 7:30 a.m. on the defense appropriations bill before they can turn back to health care. Is there any way that you see that this can actually get done by Christmas Eve or even Christmas Day at this point?
I wouldn't bet a lot of money on it, Lawrence. You know the workings of the Senate better than I, having worked there yourself. The majority leader can call him in, and he can try to move this stuff. But it's going to be a fascinating week. And add to it, of course, we're expecting a historic snowfall tonight, beginning tonight here in Washington, up to 16 inches. So
it's going to have to be a walk to work day for senators tomorrow.
They'll just have to sleep there.
MSNBC political analyst Eugene Robinson, also of the Washington Post. Thanks for your time.
Good to be here.